Do you know that 1 in 10 patients experience medical errors while receiving hospital care? Do you know 2.6 million deaths are caused by medical errors each year? 15% of total hospitals' activity and expenditure is a direct result of medical errors. Now let us have a look at this picture of a room where medical files are stored at a hospital that is not using electronic health record. Each of these paper files includes vital information about a patient. Imagine in a moment of emergency, how difficult it would be to find the medical record of a certain patient from the record-keeping room. For the lack of instant accessibility to information, a doctor may have to make critical decisions without assessing prior medical conditions of a patient, which can be very well lead to some adverse event. This is just one scenario. If we can automate this pile of paper as systems mature, we'll have new information to understand and what and who causes medical errors. We'll also have health system interoperability, which will ensure patients' health records from one hospital are made readily available to other hospitals and physicians. Wearable devices, screening tools, mobile health can ensure real-time health data sharing within the healthcare network. These systems will improve decision support for doctors, and we will be able to understand how to provide personalized care. So what is digital health and why reimagining this digital healthcare is important? So digital health is a cultural information initiated by advanced technologies that lead to an equal level partnership between patients and their caregivers. The healthcare sector is significantly behind other sectors in terms of using data and emerging technologies. Even though some of our hospitals brought some technological advancements with a very limited scope, most of them were focused on the just internal automation rather than patient care. If the hospitals transformed themselves digitally in the pre-pandemic period, we probably would not have lost so many experienced doctors, healthcare staffs, and patients during this pandemic. Moreover, the hospitals could have offered much better and much safer healthcare services to more people, even with their limited manpower. So the tech giants like Google and Apple are betting big time on digital health and wellnesses. If our healthcare organizations fail to stay relevant with the Industry 4.0 movement, soon many of them will lose their places to these global tech giants. So several health tech solutions to transform a traditional hospital into a virtual one are already available in our country. Our company, eGeneration, we are proud to provide health management information system, HMIS, ICU Over the Cloud, electronic medical record, Tele-radiology, Telemedicine, and artificial intelligence-enabled chatbot solutions to hospitals. The next level of health tech innovations is combining these healthcare services with emerging technologies like AI, health analytics, augmented and virtual reality, and of course, Internet of Things. And the very first step to achieve this digital healthcare system is to formulate a digital transformation strategy for the hospitals. So a well-designed digital transformation strategy should have some essential elements such as alignment of the organizational objectives, mission and vision, defining IT requirements and scope, auditing the current capabilities and infrastructure. So you have to define the overall architecture, mapping business processes with IT architecture, defining objectives and key results, validating budgets, and finally, identification of the right resources. So when the Industry 4.0 revolution started, it gave us an opportunity to embrace technologies in our workflows. Some of us took the opportunity, many of us waited. And this pandemic has come with a new reality that will not allow us to wait any longer, especially in the healthcare sector where human lives are concerned. So, the burning question right now, will healthcare in Bangladesh embrace digital or die waiting?